Assalamu alaikum everyone, welcome to my channel. Hope you all are doing well. Today we are going to be discussing the introduction to psychology as to how psychology is a behavioral science, the scope of psychology and clinical psychology. Also we're going to be discussing the history of psychology. So let's begin. Introduction of psychology. Psychology is the scientific study of mind and behavior. It is the field of science dedicated to understanding human motivations, behavior, and the mind. Psychology is the mental characteristics or attitude of a person or a group. What is the scope of psychology? The field of psychology can be understood by various subfields of psychology, making an attempt in meeting the goals of psychology. What is clinical psychology? Clinical psychology is a broad branch of psychology that focuses on diagnosing and treating mental, emotional, and behavioral disorders. Some of the more common disorders that might be treated include learning disabilities. Let's focus on the models. The work performed by clinical psychologists tend to be done inside various therapy models. A popular model is the Cognitive Behavioral Therapy (CBT) framework. One of the most famous CBT therapies is cognitive therapy. What is cognitive therapy? It is focused on depression and developed a list of errors in thinking that could propose or maintain depression, including arbitrary inference, selective abstraction over generalization and magnification, and minimization of positives. Cognitive therapy seeks to identify and change distorted or unrealistic ways of thinking and therefore to influence emotion and behavior. Let's discuss the history of psychology. The early clinical psychology by the second half of the 1800s. The scientific study of psychology was becoming well established in university laboratories. Although there were a few scattered voices calling for an applied psychology, the general field looked down upon this idea and insisted on pure science as the only respectable practice. The field of psychology became more recognized during the second half of the 19th century, although clinical psychology was not recognized until the end of the 19th century. It was around this time that Leitner Whitmer first helped treat a boy with learning disability. In 1907, he coined the phrase clinical psychology in his new psychology journal called the Psychology Clinic. Even as clinical psychology was growing, working with issues of serious mental distress remained the domain of psychiatrists and neurologists. However, clinical psychologists continued to make inroads to this area due to their increasing skill at psychological assessment. Psychologists' reputation as assessment experts became solidified during World War I with the development of two intelligence tests, Army Alpha and Army Beta, testing verbal and non-verbal skills respectively, which could be used with large groups of recruits. Let's discuss about the early professional organizations. The field began to organize under the name clinical psychology in 1917 with the founding of the American Association of Clinical Psychology. This only lasted until 1919, after which the American Psychological Association, founded by G. Stanley Hall in 1892, developed a section on clinical psychology, which offered certification until 1927. Growth in the field was slow for the next few years when various unconnected psychological organizations came together as the American Association of Applied Psychology in 1930, which would act as the primary forum for psychologists until World War I. Until after World War II, when the APA reorganized. In 1945, the APA created what is now called Division 12, its division of clinical psychology, which remains a leading organization in the field. Psychological societies and associations in other English-speaking countries developed similar divisions, including in Britain, Canada, Australia, and New Zealand. World War II and the integration of treatment. When World War II broke out, the military once again called upon clinical psychologists. As soldiers began to return from combat, psychologists started to notice symptoms of psychological trauma labeled shell shock, eventually to be termed post-traumatic stress disorder, that were best treated as soon as possible. because physicians, including psychiatrists, were overextended in treating bodily injuries. Psychologists were called to help treat this condition. At the same time, female psychologists who were excluded from the war effort formed the National Council of Women Psychologists with the purpose of helping communities deal with the stresses of war and giving young mothers advice on child rearing. Let's focus on the objectives of clinical psychology. Clinical psychologists work in many areas depending on the population they choose to treat. A psychologist can specialize in chronic illness like diabetes or obesity, mental problems like depression and anxiety, and psychological problems like bipolar or schizophrenia. They work with children and adults with ADD or Asperger's syndrome. In a school setting, they can help children with learning disabilities. At a university, they can help students make career decisions, stay emotionally healthy, and achieve success academically. In community-based facilities, they can help culturally diverse and economically disadvantaged populations. As the country ages, many are working with seniors, others do research into mental health issues, policies, and training, represented by the Society for a Science of Clinical Psychology. What is the scope of psychology? Individuals pursuing clinical psychology careers will often find that they will be able to secure employment in a number of different healthcare facilities, such as hospitals and mental health facilities. Depending on their specialties, clinical psychologists might also be able to find employment with a number of other private and government run organizations. Universities often employ clinical psychologists, for example, to perform research and help steer eager young minds towards clinical psychology careers. Schools, police departments, and military branches are also usually in need of professional psychologists as well. Many clinical psychologists also choose to open their own private practices and work for no other boss but themselves. Opening a private psychology practice can often be expensive and difficult, but can also be very rewarding and lucrative as well. Let's discuss the procedures of clinical psychology. First of all, let's look at assessment. Diagnostic interviewing, behavioral assessment, administration, and interpretation of psychological test measures include the assessment in clinical psychology. Intervention includes clinical services to individuals, families, and groups. Consultation includes inter- and intra-professional practice with other health and behavioral health professionals and organizations. Research includes engagement with specific research and critical review of science, knowledge, and methods pertaining to clinical psychology.